The first amendment is to abolish what has come to be known as core payments. Core payments means that the scheme pays a portion of the bill that the provider, either a private hospital or a doctor, charges to a patient. Now, because they pay a portion of the bill, the rest of the money is supposed to be paid by the patient from their own pocket. Now, this amendment means that every cent charged to the patient must be settled fully by the medical scheme, and the patient should not be burdened with having to pay anything. The data at our disposal shows that medical schemes are holding in reserve, as I'm speaking now, close to 60 billion rand that is not being used. Granted, of course, there is a statutory requirement, meaning requirement by law, that medical schemes should have 25% of their income in reserve, because this is to cater for emergencies. But our problem, our bone of contention is that this 60 billion rand is equivalent to 33% reserves, which means unnecessary accumulation at the expense of patients. Almost 2/3 of principal members of medical aid scheme, that means those who are paying the premium, pay a monthly sum to a broker as part of their premium. Many of these members do not even know that they are paying this money every month, which by now is 90 rand per month from each member. The total amount paid to brokers by members of medical scheme, many of them without their knowledge, is now 2.2 billion rand. We want this money to be available to pay for direct health expenses of members, rather than saving brokers who are actually not needed in the healthcare system. We contend that because we believe the rest of the insurance market might need brokers, not the healthcare system. And as the 2.2 billion rand paid to them will better serve the needs of members of medical aid scheme. The bill has got 9 sections. 1, establishment of the NHI fund. 2, right to health care, as it is in section 27 of the Constitution, through the board of the fund, the CEO, ministerial committees, because there are going to be many committees. Under NHI, the system is not going to be controlled by the state as it is at the present moment. There's going to be a lot of control by committees that include civil society, which we'll call ministerial committees. Committees that will be doing all sorts of things like determining benefits, determining prices, deciding where the system must go. These committees must include civil society, academics, activists, etc., etc. And there are general provisions applicable to operation of the fund, complaints and appeals, financial matters, and miscellaneous. There are 9. Now, I said I can't take you through the bill. It will be impossible. But I can take you through common features. Maintaining an efficient fund through the consolidation of revenue so as to protect users against financial risk. 2, serving as the single public purchaser of health services in terms of this act so as to ensure the equitable and fair distribution and use of healthcare services. 3, ensuring the sustainability of funding for healthcare services. And 4, providing for equity and efficiency in funding by actively purchasing healthcare services, medicines, health goods, and health-related products from certified, accredited, and contracted service providers